Good afternoon and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist, welcoming you to our second episode of our sexology program in the Thursday afternoon. Our phone number here live is 951-922-3532.
And I'm Dr. Robert Jaffe. I'm also a licensed marriage and family therapist, and I'm a certified hypnotherapist as well. I'm here with Dr. Rashidian to share with you some of what we've learned over many, many years, and many, and it's becoming even more many, of study and practice about how to feel more loving and joyful every day of our lives. We believe that we're born into the world as our loving, authentic, true selves. We come in happy, joyous. We come in loving. We come in open, curious. We come in sexual. We come in trusting. And we also have the capacity to be compassionate with others, connected emotionally with other people, as well as confident, and that's it.
And sexual.
Oh, of course, and sexual.
And sexual.
How could I forget that?
How can you forget that when we are going to be talking about
sex? Right.
Right. So
right.
How can you forget about sexual?
My bad.
No, you're not. You just, I don't know where your mind was today, but not on the sexuality. Probably.
I guess not.
No. So here I have a code for you.
Oh, good.
Right.
Okay.
And I'm not sure how to pronounce the name of the person who actually said this code, but I truly appreciate, the code. So here we go. As we do the necessary work of calling out racism and sexism in the media that increasingly permeates our lives, we always need to be careful of one thing. Arguing that women shouldn't be objectified by the media doesn't mean that women should be ashamed of their bodies or their sexuality. Let's remember the difference between sexualization and a healthy self-expression of our sexuality.
Beautiful.
Yes.
Beautiful.
Yes. I mean, that can be better than that, better said than that, really. So amazing.
That was Aviva Dove Viban.
Viban. Yes.
Yes.
So we thank you, Aviva, for creating this amazing, code for us. We appreciate that. And we are proud to share it here with our listeners and our viewers.
Mm-hmm.
So, yes, this program, this hour is dedicated to sexuality, sex education, because we both believe that, awareness, education, and prevention of many things that can come to us as a result of our sexuality, sexual behavior, sexual habits, sexual beliefs, and what we can miss out also at the same time is really important to know about.
Exactly. Yeah. And I also want to add that when we try to repress sexuality and we repress sexual feelings, it always comes out in a way that's destructive to us and others.
Right.
So it's important to admit, not just admit, but to celebrate the fact that we are all born sexual, and that's part of our heritage. We are sexual beings, and that's something to celebrate.
Exactly. As we celebrate everything in our lives, our sexuality is a core part of who we are, and that also deserves, similar celebration, if not more.
Mm-hmm.
Right.
Yeah.
And so I want to say that, month of May is Sex Education Month.
Okay.
Right. So that means that during this month, as well as every other month after that, the focus is on how to provide education about what is updated,
Mm-hmm.
what is new, and what is not new, but is normally needed to be known about.
Right.
So organizations such as Kinsey Institute World Health Organizations, and there are so many other organizations that they are focusing on sexuality and doing research about it. They always one of their aim is to provide education.
Mm-hmm.
One of their aim is to show how sexuality is a healthy sexuality is much needed for our relationships,
Mm-hmm.
for the way we live, and for who we are as a person.
Mm-hmm.
Right? And without those education, without those awareness, without those necessary knowledge that we all must have in society, we may not end up having a sexual health that we deserve to experience.
Right. And so perhaps we can talk a little bit today maybe about what sexual health is, because there's two parts to it, right? There's physical sexual health, right, which is being aware of our of what we need to do physically to keep ourselves healthy.
Right.
And then there's emotional sexual health, which is how do we deal with the strong feelings and also the strong beliefs and also strong prejudices that go along with sexuality.
Right. So that's a good question. That's a good plan. The reality is that to do that, to achieve the goal of your comment, is for us to have the right people, the right resources, so that we can go to and then understand what to ask. And for those who are in charge of that, to know what to respond, how to respond back, and what to say.
Right.
Right. So, based on my own work, which I have been involved in for the past 20 years, to say the least, we know that, I can conclude that, I wrote some notes here so I can be accurate in what I want to say. Actually, sexuality and intimate relationships are so essentials to our everybody, I would say, right? And then it's essential to our well-being altogether. Right. And when I'm talking about well-being, that includes the emotional part and the physical aspect of it.
Right.
Right. So I have focused on research and education about sexuality, about gender, about sexual health care. And during all of when I was doing my research and after that and now, I have always focused on what are the roadblocks to providing, healthy sexual, information. And I did come across the fact that physicians, to begin with, they're not fully or not even minimally participating in sexual health care. I know that therapists struggle with that, right? So I know that teachers struggle with that.
And that's because
it's because the so many stigmas that they are attached to human sexuality.
Right.
Right. But right now, this is really essential to pay attention to. We are in, COVID-19 time of our lives, right?
Yes.
You and I certainly, as also millions and millions of people didn't know that they're going to wake up someday in February and then they are told that they need to go through social distancing and life is going to change for the most part for an unknown time, right? So we realized that, that was a shock of the century, perhaps, in the history of life, at least our generation. And then after that, we hear so many things about how this virus is impacting us, right? So when it comes to sexuality, how does COVID-19 impact us, right? What's interesting, I'm looking at in New York City, health documents that they published not too long ago. And the first thing that they said was that you are your own safest sexual partner, right? So the first thing that came to mind as a result of that is that people just believed, oh, they're saying that we should all do masturbation, as part of,
Safe sex.
And yes, that's true. That's definitely what's recommended, and especially for those who are single and they had multiple partners, or those that they were not in a fixed relationship, or for a variety of people, suddenly they face this dilemma of how am I going to have sex, right? And then for for married couples who were living together, the presence of children suddenly became a factor. Now all the kids are home, so we can have our usual sexual habit and behaviors, and we need to keep it low and keep it down, right? And then there were the group that one family member was contracted with the virus. So then many things has changed as a result of that. And now we have this report. I got this article from JAMA, Journal of American Medical Association, that based on a study that was done, let me just read that so that I can be accurate about my information. In Shanghai Municipal Hospital, this study was done between January 26 through February 16 of this year. And they had it was a cohort study, so that means they had a group of patients who were admitted to the hospital because of corona, and the age range was starting from 15. So that the idea that we were told that teenagers won't get the virus, or young people won't get the virus, is out, because we know that some of the participants in that research were they had the age of 15 and up. So that includes teenagers, and that includes adults and older adults. And the study shows that once they recover from the coronavirus, right, in their sperm, there was a sign of virus. So it stays there. It stays in men's semen, and definitely that was an alarming factor. That's an alarming findings, because now there are this finding is opening the door to so many other questions that we didn't ask ourselves before, right? And I'd like to continue with that after our commercial break, because I think this is something that, as part of awareness and education, our public need to know. Because this definitely is going to impact how people are going to have sex from this point forward.
Yeah, I think it's a good thing to pick up on after our break.
Right.
Yeah.
Thanks. So we see you all after our break, and please don't forget to call us, ask questions. Our phone number here is 951-922-3532. See you shortly. Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Dr. Mitra and Dr. Robert here. We're talking today about updates on COVID-19 and how it can impact our sexuality based on the research that was done by JAMA, Journal of American Medical Association.
Absolutely.
Right. So please call us, 951-922-3532. We would like to hear from you. Please ask us your questions, comments. And if you believe that somebody else that you know may benefit from this program, please introduce them to our show. You can also see us at YouTube, Heart-2-Heart.online/YouTube, or you can also download the programs, the archive programs from KMET website. So thank you. So we were talking to Dr. Robert about the new finding about the fact that COVID-19 can continue to stay in men's sperm even after they are recovered from the virus.
In the semen.
Right? In the semen, right?
And of course, we don't know what that actually means yet.
Well, there are some predictions, and there are so many factors that they are unknown.
Yeah.
However, as a there are some precautionary steps that they are introduced until they get the full picture of what's going to happen. So one of the things is that this is going to change the way that couples who have been living together, right? And one of them has been contracted with the virus. Now they are forced to wear condom. Okay, even before they didn't, right? The education about the use of condom is significantly needs to be enforced, right? And also the fact that it must be a mandatory thing for during sex right now until they can have better understanding of how this existence of the virus in the men's semen can impact, their partners.
Right.
Well, the studies that cannot be completed as of yet, because this is relatively new. We're looking at this. We are in the third month, so we don't know exactly how this existence of the COVID-19 virus in men's semen can actually impact a fetus here.
Yes.
We don't know
that,
know yet. Right? So we have to wait until the first series of newborns within 9 months so that we can, studies can be done about that. They don't know if this is something like HIV or AIDS or any other sexual transmitted diseases or infections.
Right.
So this study actually became the fundamental ones, which has opened the door for so many other studies that they have been started. So everybody, every researcher that they are involved in sexuality and of this magnitude, they are now, investigating to see what's the next outcome. Is this another sexual transmitted infection? Is this another transmitted disease?
Right.
Is it as big as HIV and AIDS, or is it bigger? So there is so much that we don't know about it.
Right.
Right. But what's one thing that we know for sure is that who needs sex education?
Everyone.
Everybody. Yes.
Yeah.
Whether we are a child, whether we are an adult, whether we are mid-age, whether we are sexually active, whether we are not. Now it's time to put all the stigmas. Now it's time to put all the cultural do's and don'ts and limitations aside, because this has to do directly with our life and with our well-being.
Right. Absolutely.
Yeah.
Now, I had mentioned to you during the break that you had brought up the New York study, which said that the safest person to have sex with is yourself.
Right.
And I had mentioned that, okay, so we're talking about masturbation and that we now know that physiologically that masturbation is really healthy for somebody because it creates it releases endorphins, and it creates besides the fact that it's pleasurable, it creates positive changes, chemical changes in the body. However, we also know that there are religions who frown on it and who say, that it's not a good thing. And so I wanted to bring that up because people can be caught in between.
Right. Right.
And I think it's important to let people know that nobody has the right to tell you what you can do with your body. That's a personal decision. And that doesn't, and that includes the clergy, and it includes any religion. They don't have the right to tell you what's right for you in that way. Now, if you believe that that's not right for you, then you act accordingly, of course. But this is about looking at the facts, not at the belief systems so much. And so the facts tell us that there's nothing unhealthy about it. It's not like they used to when I was a kid. They would say you would get warts on your hand if you masturbated. It's nothing like that. It's all going to be.
Or you will go blind.
Or you'll go blind. Exactly. Yeah. So I wanted to comment on that because We are entitled in this country to life, liberty, and the pursuit of happiness, and that means that we have to decide for ourselves, as long as we're not hurting another individual, what is right for us.
Right. I mean, masturbation historically has been a concept that has been used either for people or against people. Cultural factors globally during different historical times have targeted people who have been masturbating or not. And of course, masturbation among men has been and still is more common and more acceptable than it is for women, even though we see that there are so many sex toys around, then women use them, obviously. But that's more so in Western societies. It's not common thing to do in collective societies or more conservative societies.
Right.
Or even depending on how orthodox we are with our religious belief. Whether we are from a Western population or we are not, or belong to another culture, still depending on the intensity of our cultural belief, we women find themselves comfortable with using the sex toys. Right. or not, right? And among those that they do, still many of them keep it in a hiding, don't share information, or seldom we see a very small group that they are open and honest about the use of sex toys or what type they use, and willing to share the information with their friends.
Correct.
So we see that masturbation still is something that as part of sexuality, a taboo topic again.
Well, yeah, it's a taboo topic. And especially for women,
right.
Because I think women's sexuality has been very misunderstood,
right,
and still is.
Yeah.
And as a result of that, also men trying to control women.
Yes.
They have used their physical strength in the past to say that we know best. And you and I were talking about this recently, that it wasn't that long ago where it was considered that a man could own a woman, or a man could own a woman and the children, that they would be like possessions, and the man could pretty much do whatever he wanted without any laws or repercussions. It's only been, it was in 1968, where we had the Equal Rights Amendment. I mean, so we're talking about a change, a cultural change over many, many hundreds of years that it takes to get new ideas, which now seem to some of us who are educated to be obvious. But to get new ideas across to people, to say, for example, that spanking is not a good idea, or
right.
physical punishment is not a good idea.
Right. I mean, there are places still that men, for the most part, are legally allowed to own women. For example, in the areas where a man can have 4 legal wives, right? So that's pretty much, owning.
Correct.
Owning women, and then. And that's okay to do by their local law, right? So imagine somebody like that and get COVID-19. Do you think that this person is going to think of their wives, his wife's well-being? I mean, I don't know. That's questionable to me whether that's something like that can happen.
Yeah.
And then what kind of a sexual education are they providing to their children, right? So the submissiveness, the aggressiveness, the hierarchy, all of that. This is how one way that actually starts, right? And then women's sexuality. So not to get away from the topic of masturbation, I have had a few female people that when they see me in seminars or the other places, they come to me and they say, I want to say something to you. And I say, sure. And they say, is it okay if I tell you I masturbate? You're the first person that I'm saying this to. you know.
And that's in modern times.
That's in modern
times. Yes, yeah.
That's fairly recent. I'm
Yes,
talking about.
as though there's something shameful and something that you don't want to admit because it's not it's frowned upon. It's looked at as though
well, it's a sinful act. It is looked
right.
at as it's a sinful
act. Yeah.
It's a shameful act, and women should feel ashamed and feel,
and feel bad.
and feel guilty about, deciding to take care of their sexuality in a healthy way, as a matter of fact, when there is no partner, right? Or if there is a partner, the partner is unable to provide sexual, activities and take care of sexual needs for both of them due to a variety of factors. I mean,
yeah. But I want to say even something about what you just said, as though you would only masturbate if you don't have a partner.
Right. No, that's one aspect of it. Yes.
Because regardless of whether you have a partner or not, you may choose to masturbate at other times, and so what? Right.
Yeah. So I think I think you just gave me an idea. Maybe one of our shows needs to be devoted to the importance of masturbation in relationship.
Okay.
You know me, I don't stop at any topic.
Okay, right? That's good. Yeah.
Right.
Yes.
Because you're right. Masturbation is not just limited in the absence of a partner.
Right.
It is actually a healthy part of sexual activity within a relationship.
Within or outside of a relationship. And it's healthy. And I think we're going to, when we talk about that, I think we're going to provide some more physiological facts about why it's so healthy, because there's a lot of physiological changes that take place during the arousal phase and during orgasm that affects the body in a positive way.
That, and also how important that is in terms of both partners to understand what gives them more pleasure, how to understand their body parts, genital area, how to understand and learn about their sensitive, points of their genital area.
Yes.
And what gives them more pleasure.
Yes.
Right. So masturbation not only is not a sinful act, not only is a bad thing, not only it's a shameful thing, but it's a life necessity when it comes to our sexual health care, whether we are in a relationship or whether we are not in a relationship, right?
Yes.
So that's important to consider. And right now, in particular, due to COVID-19 situation, when partners, are not able to have sexual contact with each other for a variety of factors that we kind of summarize some of them at the beginning of the show up to now, it's a healthy way of taking care of our, sexual needs, and also learning about each other more so. And that can be a new or maybe an extension of how we can become more intimate with each other.
Yeah. And I want to say that there's a paradox here too, because some people choose to stay celibate. They choose to stay celibate either for religious reasons, or they choose to stay celibate for personal reasons of having religious experiences. They believe that staying celibate helps them transcend. And I want to say that that's perfectly okay too.
Yeah, that's perfectly okay.
I don't want people to feel badly if they choose not to masturbate, or they feel like, oh, I'm not doing something good for myself. It's a personal choice.
Right.
But in general, society has frowned so much upon this that we're focused more now on letting people know that it is healthy to do.
It's healthy to do, in particular, for those young group of people, teenagers, and who are just learning about their sexuality. I have seen and I have heard from parents where they say, oh my God, I have to say something and I'm so embarrassed to share it with you. And I say, you want to tell me that your child is masturbating? And then they say, well, how did you know that?
And you said, well, is your child human?
You know.
Yeah, my child's human. Okay, well, guess what?
Yeah.
Yeah.
So I like to kind of shed light on some of this, when we come back from our commercial break.
Okay.
So that parents feel more ease and more feel, confident and comfortable when they need to, see that their children, their sweet angels, now suddenly, they say, oh my God, what happened to my child? Well, your child is growing now.
And your child is still your
It
child.
still is your child, and it's a sweet angel as well,
Yes,
right?
yes.
So more of this after our commercial break. Looking forward to speaking with you about this fascinating topic. See you shortly. For those of you who are just tuning in, our program is about COVID-19 and sex and masturbation as a solution, and also learning about how this virus can stay in the semen of men, those who have actually recovered from this disease, and what can come up next about the prevention of it, and whether that it actually can be considered a new sexual transmitted disease or a new sexual transmitted infection, and the impact of that on our newborns, or how it may impact pregnancy. There are so many questions that we don't know, but this finding significantly is opening the doors to more research and to more understanding about the impact of this virus when it comes to our sexual health. And for that reason, that is, we are really focusing on what to do, how to take care of ourselves in order to stay safe, and who actually needs sex education in particular at this point. So we will say that pretty much everyone needs to do that. I mean, I was listening to Dr. Stella Resnick about some of what she said, and I like to go over some of the details that she said as to why everybody needs sex education in particular at this time.
And,
right?
Dr. Resnick is an expert in sexuality.
An expert in sexuality, yes. So she said that we all do, and because certainly we can get our education from movie theaters. Of course, we don't have movie theaters right now, but what I think was referring to, that right now everybody is on social media, everybody looks up at internet, and there are so many information there, and especially young people get most of their information from porn industry, which is fairly available and easy to access, online. So that's one area that we really need to monitor what's going on. And to do that, children definitely, need their sex educations, and they're not often, they're not getting it from parents, they're not getting it from teachers, they're not getting it from anybody. They're getting it from their friends who don't know more than they do, or they get it from online, right? So that's a danger part, because with all the online child abuse that's going on, we want to be sure that our children are really safe. They're teenagers, their body is changing, they are having those instant sexual urges, and they're excited about the body changes and all of that. So they share with their friends, and then they receive education from their friends about what to do. And of course, they masturbate. Right?
Yeah. I was watching a movie the other day, and it was about kids. It was about 12, 13, 14-year-old boys and girls. And the boys were teasing the girls, and they took one of the girls' purses. And they ran away with it, and the girls were, come back, and they took the purse, and then they emptied the purse, and there were three of the boys, and one of the items they took out was a tampon. It was still wrapped, and the boys look in, and he goes, what is this? And one of the other boys says, oh, well, that's a tampon. And he goes, Tim, on what is that for? He says, I think it's so women put it up their butts so that they can't have babies.
Exactly. I mean, they really don't. And, it's not their fault, really, because they don't know. And
Yeah.
they don't know because the resources for teen sex educations are very limited. And one of the limitation, is because parents don't allow it. Parents believe that once their teenage child learns about sexuality or receives sex education, they're actually going to go for it more so. Well, I have a bad news for those parents. The distance, the time limit between whether they receive sex education and until they have the actual sex practice with or without education is maximum 6 months.
Mm-hmm.
So they're going to do it anyway.
Mm-hmm.
They're going to have sex anyway.
Mm-hmm.
They're going to masturbate anyway, because that's a natural human response. We cannot say don't stay hungry. We cannot say don't drink water. We cannot say don't sleep. We can't say don't have sex. It's going to happen.
Right.
So It's best to have it at least with education rather than no education.
Well, yeah, and education certainly is the key. Now, I was mentioning earlier that we need to educate people not just about the physiology of having sex, right? Although that's important, and also about the safety of having sex. That's very important. But we also have to educate people about the emotions of having sex, and the way that men and women may look differently at having sex and what it means to them, especially when they're young, especially when they're in their teenage years, and talking about it in terms of emotions and in terms of peer pressure and in terms of knowing what you want and knowing what you don't want and feeling okay to express that whenever you're about to engage in any kind of sexual encounter. Also, including any kind of sexual encounter, starting with kissing. People don't recognize that kissing is a sexual act.
Right.
Yeah.
Yeah, but making out, it is sex.
And what's going to happen if I kiss this person?
Right. Exactly. So we see that, parents are actually need to receive sex education themselves in terms of how to talk, to their children and feel and get comfortable doing that.
Mm-hmm.
And same thing with teachers. Teachers also need to get in a habit of learning about sex education, having sex education, so that when they see their students, sexual behaviors, they can recognize them so that they can offer them help in terms of understanding the physiological and emotional changes, and then help the students to understand what's going on with them. And the second two groups that I like to really focus on here, number one are therapists, right?
Mm-hmm.
Therapists, I remember when I received my sex education training at the school, it was just one semester, one course, 1 hour per week.
Mm-hmm. Right.
So I had maybe altogether, I don't know how many hours was that, maybe 10 hours?
Maybe, yeah.
10, 12 hours?
Yeah.
So how can, 10, 12 hours of education with no practice,
mm-hmm.
right, with no training of a deeper level, can help our clients when that they are actually struggling with their sexuality.
Yes.
Right. So the therapist needs to actually sign up for courses that they are giving them sex education
mm-hmm.
as part of being able to at least understand the signs and symptoms of sexual problems and limitations, so that they can do the proper referral to those who are expert in this area.
Right. And also to educate themselves, to
Right.
take responsibility, to look up the people who are tops in the field, and then to do, and most of them have published, and to read what they've read,
Right.
and as well as take courses, to keep up with what's most important, which is our sexuality. That is, and it also, it's sort of like when people go into medical doctors, and the medical doctors don't really even check about the person's sexual health.
Right.
They don't ask questions. They don't probe. If at best they may say, how's your sex life? And if the other person goes, oh, no problem, then that's it. It's like,
That's exactly, yeah.
And,
I mean, how many of us have gone to our gynecologist, and that gynecology asks us, well, tell me about your sex life. Well, my gynecology comes in 3 minutes. She just does the speculum and then walks out. And I even have to stop her to ask questions from her.
Yeah.
So they're not even, and then of course, this is my research, as you know, that I have done for the past 10 years plus, focusing on how physicians are reluctant to talk about sexuality with their patients. And there are so many factors. It's a multi-layered factor. So it's culture, it's economy, it's politics, it's universities, is how they see that important or not. So we see that those who are in charge of providing sexual education, and they are not informed enough themselves to do that. Which is sad, which is really sad to say that, but that's the reality.
As therapists, we are trained a lot in communication. So
theoretical orientation.
But communication. We talk. We're trained in how to communicate, with our patients, and how to have our patients communicate with each other. But what we don't get training in is how to communicate about the big secret.
Right.
And the big secret is that we're all sexual. And the big secret,
it's no longer a secret.
Yes. Well, it's a secret, and it's not a secret because people don't share that. They don't talk about it because number one, it's very personal, and number two, all of the roadblocks that you were attesting to a moment ago.
Right.
So that we're not taught how to talk about stuff that's sexual with our clients who aren't bringing that up. We're willing to talk about them if they say I have a sexual problem, but if they come in and they don't say it, we don't probe, we don't ask, we don't try to find out.
I mean, if I can tell you how many times when I have had a couple here in my office, and I have asked them, I had to do an assessment to see if they are comfortable to talk about their sexuality or not. Majority of the time they're not initially, and then when I tell them that that's a line that needs to be opened up, and they say, well, we don't want to talk about that, just forget about that, we're not comfortable, we have no problem there. And only to find out that majority of the problem isn't coming from the bedroom, or it is
or at least it's a big part of it.
Big part of it
Sure.
is in the bedroom, and how that aspect is being ignored, and they're just putting pointing fingers at each other as a source of problem. So sex education is important, and right now we are in a situation with these new findings that this is just one of them and the beginning part of it. It tells us that during COVID-19 time, whatever that timeline is, we have no idea. There are certain things that we can follow, and the government information, the local information, friends information. I mean, we can't get enough information, and we are following those. We are all wearing masks when we go outside, when we go to supermarket. We are staying away from our loved ones because we can't see them due to social distancing. We are respecting all of that. We also need to actually respect ourselves when it comes to our sexuality. And now with these new findings, we must use condom, right? And we must, use alternative to take care of our sexual needs. And masturbation right now is the #1 choice and the best choice, right? It
Right.
doesn't mean have isolated sex if you are a couple. You can have sex with your partner, but not the way it used to be. And wearing condom is essential if you must do that. Even, I mean, we don't know exactly how this virus is operating, but if it is in the semen of a man who have been recovered from this disease, so that means that, this virus
that means
has
it's gonna
found
it's gonna
itself,
be
it's going to
transferred.
be transferred.
Yeah.
So whether it's officially, it's not officially named as a sexual transmitted disease or infection, but it is there.
It's there.
It's there.
Yeah.
It's there, and it needs to be known about, and it needs to be considered as a danger sign, and it needs to be educated about. We need to let, our loved ones know, those that we believe they are sexually active, and those that we don't believe they are sexually active. So that, they have firsthand information about the use of condoms, just the same as the use of masking. This is even more important than the use of, masking, in my opinion, if I may say that. And so we need to take every measure of, precaution in order to keep ourselves safe, keep our loved ones safe until the next information is out, and then just God willing, with the help of God, this virus is gonna go away, and we're gonna have, vaccine or something to keep us safe.
Yeah. And so I think next time what I'd like to do, if it's okay with you, is I'd like to talk about how to talk to our kids about sex, and we can talk to our kids, and we can separate different age groups. So how do we talk to our kids, like say between 5 and 10, and how do we talk to our kids between 10 and 12, and 12 and 15, and 15 and 18? How can we bring up the topic when we ourselves are so uncomfortable with it? I think that would be a good topic.
I think that's a great topic, and I'm looking forward to talk to all of you who are sharing your hour with us. Until next time, be safe and talk soon.
Talk to you next week.
Serving the Inland Empire and desert communities, this is 1490 AM KMET, Banning, Beaumont, Redlands, and Palm Springs.
From ABC News, I'm Daria Albinger. The CDC has outlined its most specific guidelines yet on what businesses and schools need to do to reopen as safely as possible in the wake of COVID-19. But they're coming out after many states have started to lift restrictions.
The CDC giving businesses a Q&A decision tool to help make the call to reopen. In one